So in today's episode, we're going to be naming something that many, many, many women are living with, a lot more than you realize. But most of them don't know how to describe the experience that they're living through. And it's something that I call reproductive anxiety disorder, or RAD. And this is more than tocophobia. It's more than fear. In fact, it's this hidden nervous system based anxiety condition that's just been dismissed. It's been mislabeled, misunderstood, misdiagnosed until now. And so we're going to unpack exactly what that is, why it matters, and why so many people who live with it don't even know they have it. This is going to be such an important episode for you.
It really is, because for so many of us, we have no idea, and we don't have the language. We can't even go to a doctor and say, "I think I've got X," because it doesn't really marry with anything that is in the doctor's purview. So this is looking at reproductive anxiety disorder as a real thing, and we'll explain what it is and how it's affected us as well. Obviously,
Yeah.
we're always going to give you some of our own experience of it, so that you can get an idea and be able to say, maybe I do have that and I'm not
Yeah.
just crazy after all.
And I just want to, before we dive into all of that, I want to kind of explain why I felt personally the need to give this a name and to label it, because I think that's important. And I think the aha moment came for me when I was training, I was doing my professional training for my head trash clearance practitioners and explaining to them how, that to heal tocophobia, because I'm training others to be able to heal tocophobia in people too. And I basically said, I know it's a phobia, but you've got to ignore the fact that it's a phobia. That's just a red herring. So ignore that. And you just got to treat it like anxiety. And if you do that, then you can heal it. Because basically it's an anxiety disorder. It's not a phobia. And I kept saying that over and over again. And after all, I was like, okay, this is interesting. Why? And then I realized that also when I do I do lots of webinars and classes and for things to learn more about tocophobia. And again, I kept coming across this idea that I kept saying phobia is a little bit of it. It's not really a phobia. It's not like arachnophobia or claustrophobia or these other phobias that we think about, because it doesn't behave like a phobia. It's not treated like a phobia. It's not healed like a phobia. And in fact, we've spoken to a phobia expert who has a Harley Street phobia clinic, and we've got an interview coming soon, and he'd never heard of tocophobia. so all of this together made it quite clear to me, at least, that there was something wrong here, and we needed to sort it out. And I was more than happy to try and sort this out. It was about time,
Absolutely.
wasn't it?
Totally, definitely time. So stay with us, because we'll get into all of that right now.
So let's explain then what reproductive anxiety disorder is. And really, a good place to start is the fact that this is a full nervous system condition. We're not talking about a mindset issue that you can just think about birth differently, just, oh, look at it from this side, So when you have women that are sharing their fears, and then they get responses like, oh, well, just, women have been doing this forever. If it'll come round, you'll feel the maternal thing will kick in, and it'll be okay on the day, this kind of thing. You're like, no, that's not how this works. It's not because I'm looking at it wrong. It's in my body. Like, it's how I feel. I don't even know where it's come from, but it's visceral and it's powerful. I can't just think about this differently because it's not happening where
Not
I
happening
think.
in your head. Yeah, it's
No,
nowhere near your head. Right.
no, exactly. So that's the first clue, really, that we've got something going on here that is not really being understood. And that has got such a ripple effect in terms of how women can access support. Because if the people that really should know what's going on, the mental health professionals, the doctors, the healthcare professionals, they don't understand it. They're not labeling it properly, and they're not able to treat it effectively because they're looking at it in a way that's not helpful. we've got a problem where women aren't getting the support they need. And the cost of that is significant in terms of women's mental health. So this is
Exactly.
why we've got to really take a serious look at this. This isn't, we're not just, bored. This is
Oh,
something that is looking for something
yeah.
to do.
No, no, you're absolutely right, because it's that mislabeling that is leading to an ineffective treatment, if there is any treatment at all, because people don't understand what it is. So, in order to have effective treatment, you have to really say exactly what's going on. You have to have a proper name for it that reflects what it goes on. You don't have to, but it really does help, because when you can then as I've said before, we bring something out of the unconscious or subconscious into the conscious, then we can start to clear it. We can start to move on from it. And while the professionals don't have a proper understanding of it or a proper name for it, we're a bit lost.
Yeah. And that's not to say that all professionals don't understand it, because there are some, but unfortunately, they're in the minority. So
Yeah.
when most women are going for the help, they go to their doctor and they share how they're feeling. The doctor doesn't understand, or they're not being signposted. Maybe they're going for cervical smear tests, and the nurse doesn't understand why this woman in front of us is reacting to the way that she is to having a vaginal examination. We've got a lot of healthcare professionals that don't have an awareness of this condition, so that even when they come into contact with somebody that quite clearly is displaying symptoms of it, they don't know what they're looking at, and they don't understand what they're looking at, and they can't support her, signpost her, send her in the right direction, refer her to somebody that can actually help her.
Yeah.
And what happens is you get women hitting a critical time in their life where their body clock is like banging them in the face, hence the name of our podcast, where they're like, what's going on? I need to sort this out because my body clock says I've not got much time. Um, and so there's 15, 20 years of a woman's life that is being where she's not getting help. And she could be, if only we knew about what we were talking about. If only there was a word for it, we had understanding. So this is what we're trying to do with all of this.
Yeah.
So what is RAD then? I've talked about that being this nervous system. It's definitely this nervous system response, and it really is this. It's a fear-based shutdown, or this a response to any part of the reproductive journey. And I think that's really key to understand that even though when we think about tocophobia, our focus is about the birth and the pregnancy piece, but actually in the work that I've been doing with women, and it's been over a decade now, the trauma that is at the root of tocophobia is more than likely to be rooted in another reproductive experience. Now, more often than not, that's the birth, their own birth.
Yeah.
But sometimes it's puberty. And as you've experienced, when it goes unhealed, suddenly it hits you again in menopause.
Mm-hmm.
So all aspects, all portals, if you like, of the
Yeah.
female journey as we go through, as we enter reproductive capacity and then we come out of it, they are signified by these moments of anxiety, of fear, of something that can't be explained, that we really need to start paying more attention to and looking into. Because once you start looking through your life through the RAD lens, everything starts coming into focus in a way that it hadn't before. At least that's what's been our experience.
Yeah, it has. It has. And it's so funny doing this with you now. I'm seeing so much more when I look back over my life. Things keep popping up and I'm thinking, oh my God, that was part of it as well. Oh, that happened. So there are all kinds of signals, all kinds of little things that might indicate that you have RAD. And we're talking about all of these throughout all of these podcasts. But it's just to say it's not a thing. It's not like a fear of flying where you can see a plane, you're scared, you don't get on it because you're scared. And somebody can say, okay, we'll work with that. It's a whole spectrum of reactions which are triggered by some kind of trauma or fear.
Yeah. And I think it'd be worth saying at this point the idea that like why an anxiety disorder? And there's quite a few reasons why what we are labeling as tocophobia is an anxiety disorder. And so like one of the first things I want to say is like, well, tocophobia is not just a fear of birth. A lot of people think that that's what it is.
Yeah.
that actually when I work with women and we unpack that, there's a whole lot more that's going on in tocophobia. And this is why when I'm working with women to heal it, everybody's healing journey looks so different and can be so different. Um, and it's not this fear of birth, because actually it's this persistent, extreme, and irrational fear that's related to pregnancy, it's related to childbirth, and it's related to parenthood. And so there's three words there that I really just want to dive into in a little bit more detail. There's the persistent and the extreme and the irrational. Let me start with the persistent, right? So persistent is because it's been there forever. Like it's not just kind of popped up like 2 years ago. It's always been there. Like women that have had this have always felt that way. They haven't necessarily been always conscious of feeling that way, but it's always been there. They just thought that, well, that's just who I am. I'm not mummy material. I've never really liked kids. I didn't play with dolls. I didn't whatever, that's just not who I was. And they just put it down to them, right? Now the other bit is the extreme bit. So when I work with my clients and we're working on doing a head trash clearance, that's using head trash clearance to clear something like a fear or an anxiety. One of the parts of that process is rate it out of 10. How intense does this feel for you out of 10? And when I'm working with a lot of people, they go, oh, it's an 8 out of 10, it's a 10 out of 10. But what's been very interesting for me is when I'm doing that with my tocophobia clients, they're like, oh, it's a 20 out of 10, a 50 out of 10. Like it's really extreme. So like with women that have got mild to moderate fears around pregnancy, they'll have maybe a fear of complications showing up in birth,
Yeah.
things going wrong, not going right. Whereas women with tocophobia, like they think they're going to die. So that's
Yeah.
like the most extreme form of complications, right? So everything is extreme in with tocophobia. And then there's the other piece, which is the irrational bit. And irrational, a lot like it's described, the tocophobia is often described as an irrational fear of childbirth. And then that doesn't really make sense. That's an irrational statement in itself.
Yeah.
But irrational because they don't know why they have it or where it's come from. So for them, it makes no
Exactly.
sense because if you've not given birth before, then why would you fear giving birth? Like if you've been in a plane crash, you're like, well, that's why I've got my fear of flying. That's where that came from. I know where
Yeah.
that's from,
Yeah.
right?
Or really bad turbulence. Yeah.
Yeah,
Yeah.
or yeah, if you can point to something. Whereas with tocophobia, you've got no experience that you're aware of in your conscious memory, at least, for you to go, well,
Yeah.
that explains that then. That makes sense. Because that's what rational means. It makes sense, right? But this doesn't make sense to women because they don't know where it's come from or why they're going through it. But what they will say is like, well, it makes total sense because you can die in birth. And that they're perfectly right to say that because, maternal mortality rates are shockingly high. Um, and so that is rational. That does make
Mm.
sense. So, yeah, and that's just one reason why tocophobia is not just a fear of birth, it is an anxiety
Yeah.
disorder.
I know. I know. Yeah.
Um, but I
And
have
and that
more.
well, I was just going to say that I don't think we can stress enough that fear is sometimes so subliminated. Is that the word? Yes. That you have no idea that you really don't even know that you have it. So it's a question of looking at the clues and they're not wanting to hold babies, not feeling comfortable around babies, not wanting to hold a doll or push a doll in a doll's pram around when you're even a small child. That was me, right? I didn't want to do that. Didn't want to have anything to do with dolls. Oh no, I had teddy bears. They were much nicer. uh, and had nothing to do with people and giving birth to them. But as a child, even you're not even thinking about the actual giving birth. It's just not kind of,
Yeah,
it doesn't sit with you.
yeah,
So this is so deeply held in our bodies, in our systems,
in our
uh,
psyche.
in our
Yeah,
psyche.
yeah.
Yeah.
And that avoidance that you're talking about is that's another thing that's a feature of anxiety and anxiety disorders is the avoidance.
Yeah.
The women with tocophobia or with the reproductive anxiety disorder, they'll avoid the baby conversations, they'll avoid the family planning conversation,
Yeah.
pinning themselves down as to when they're going to start trying. They'll avoid intimacy sex because that could lead to pregnancy. They'll avoid holding a baby because that's a little bit too close for comfort. They'll avoid conversation, they'll avoid
Yeah.
anything to do with anything like that. That's the
Yeah.
avoidance, and avoidance is a defining feature of anxiety. Um, the other part of tocophobia, which again makes it more like an anxiety disorder than a phobia, is the phobic thinking patterns, is this catastrophizing, this kind of like this hypervigilance, this risk, this real like extreme control seeking that then brings in OCD and other anxiety, severe anxiety disorders. Kind of those women that suffer with this often have those other things going on. And and this has always been curious for me too. So I've had a lot of clients that have come to me with OCD, with a clinical anxiety diagnosis, and then with tocophobia. And they've been, seeing all sorts of specialists over the years with support for all of that. And then when they come to me, I'm the tocophobia specialist, so I'm not really touching the OCD or the anxiety stuff because we're very focused on what we're doing. And what's been interesting for me is the OCD and the anxiety often just falls by the wayside as a result of the work that we're doing on tocophobia. But the reverse isn't happening.
No.
So what's going on there? Right? Why would a phobia be more higher up the hierarchy, if you like, than OCD and a clinical anxiety diagnosis? Maybe, maybe, maybe this is the mother of all anxiety disorders. It's the apex anxiety disorder. And that's what my theory is. It's like, this is the one that all the other ones hang off.
Yeah.
This is the one that explains why women have got levels of anxiety that are twice as high as men, because they've got this going on that men will never have in the same way.
No. And just as you're talking there, it just brought to mind about my own anxiety. I have had until recently an underlying anxiety all my life. But for me, it was just normal. It was just normal because it had been there since birth.
Yeah.
And so, that's another thing to bear in mind, that for a lot of women, this anxiety, this level of anxiety, this underlying anxiety is just a normal thing to them. Now, they don't know that it feeds into other things. They don't know that it's informing a lot of what they do in life and a lot of what happens in life to them. So it's a tricky one that, as we're not aware enough of asking the right questions and inquiring positively and appropriately when somebody presents with something which might not be related initially, or you might not think it's related initially. I think that's where we've got a problem, because we're not inquiring deeply enough into the things that might not be obvious. Yeah. And that the person who's turning up at the doctor's, let's say, for something completely different, like when I was in my 20s and went to the doctor thinking, I've got a pain in my left side. Doctor thought it might be endometriosis, but actually it was really just psychosomatic, I think, because we were talking about children when I was with my husband, and we were talking about adopting. And yeah, sometimes, you get pains just because of the anxiety and the stress. I didn't know that, and nobody asked the right questions. So this is the other thing that we're trying to get over with RAD, talking about reproductive anxiety disorder.
Yeah.
Understanding that it's a far-reaching issue which has many roads into it, but we have to start asking the right questions to get to the root of it.
And, it begs the question as well about fertility, whereas so many women struggle with fertility. And you hear so many stories about these women that they've been trying, they've been through so many cycles of IVF, for example, and then they decide to just stop trying, and then they, and then their systems relax, and they're like, okay, it's not going to happen now. That reality, that door's closed. And so suddenly some part of them inside now feels safe.
Yeah, and then suddenly get pregnant.
And then they get pregnant, right?
Exactly.
Maybe that's reproductive anxiety disorder showing its face. Maybe.
Yeah.
And the thing is we don't know. And we don't know. Wouldn't it be great to maybe do some research around this so that we would know, so that women knew? Because the problem is there are lots of questions that are being raised here. Like, another part of this is when you look at it in this in the sense you zoom out on the whole of the reproductive journey for women that will start, well, it starts when they're born and conceived because they're born with the eggs from their grandmother. There's a thing there, isn't there, where we are carrying the memories of those births before us. So it's something that's always within us, right? But it truly starts in this lifetime with puberty, and then it ends with the menopause. And so what I find curious too is menopause symptoms and how some women have terrible menopause symptoms, the
Yeah.
brain fog, the anxiety, all these things going on. And I'm just entering menopause and I'm not really getting a lot of those. And I wonder, question mark, not saying it's definite, but is it because I've done a lot of healing around my own reproductive anxiety disorder, that my own symptoms, that my body's not screaming out in the way that it would do if there was that healing, that unresolved trauma that was asking to be healed. Maybe that's why some women have very painful periods compared to others. It may be there's so many questions
I
that,
know. I know.
that we need to find answers to. And it's not always about throwing more drugs at something, you know, and it's not always nutritional. Yes, there's a lot of nutrition that can play into this, but the body keeps the score. Like
Absolutely. Yeah.
we've got to look at the whole.
You have. Yeah, and yes, so we do need much more research. And yes, painful periods. I put my hand up. I had the worst periods ever for years. And I couldn't work out who knew why. Nobody knew why. But now that I look back and now that we're talking about it, maybe that was yet another iteration of the effects of what we're calling reproductive anxiety disorder now, RAD. So, but of course, no doctor looks at somebody with heavy periods and says, oh, you might have an anxiety disorder.
Yeah.
Never mind reproductive anxiety disorder or tokophobia. So there's a huge amount of work to do here to raise awareness and to raise the level of care
Yeah.
that women, mostly women, need with this.
Yeah.
And it starts here.
I mean, because already tocophobia has got such a low awareness rate amongst healthcare professionals. You know, like I can't. There's so many women that I've worked with that have just said they've been to their therapist, they've been to their doctor, and you know, there's some of the ways that they've been, the ways they've been spoken to, and some of the things that they've had said to them. Just. I mean, I haven't got enough eyes to do the eye rolls. You know.
You mean just have a couple of babies and you'll be fine? That one.
Well, I mean,
That...
there's just the scope of those responses. Like,
I know.
yeah, I'm speechless. I gotta get out. 'Cause I just think, oh my God,
I know.
like you really have no idea what you're dealing with here. How have you made it through training? And then it's like, oh well, it's not in training.
No.
Tocophobia is not in medical training. This is why no one's heard of it. So even the people that really should know about it, the therapists and the doctors, they don't know about it. The first line of support that women go to, they're being met with people that don't understand. And then when they are talking about some that maybe do understand, or they might label it something else, they might mislabel it, maybe perinatal anxiety, or oh, it's your hormones. Or you're just, or you've got anxiety. Maybe just you're anxious. You just
exactly.
I need to put you on meds because you've got anxiety.
Yeah.
Once you understand and look at things through the RAD lens, you can start asking the right questions and pinpointing, actually, this is RAD, this is reproductive anxiety disorder. And you know what? You need to go and have some of this over here. And within a few months, you'll be good as rain. You'll be right as rain. You know, you'll be off to the races, whatever that looks like for you.
Absolutely. And let's not forget the fatigue that can come with anxiety and the depression as well.
And the lost life, the life that you're not living, you know, as you're holding yourself back from living the life that you want. When I think about some of the things that women are going through as they're wrestling with tocophobia, you know, where they feel so isolated because they get triggered just going to the supermarket for a supermarket shop because they might see a pregnant woman, they might see a mother with her kid in a pram. You know, they're not on Facebook because they can't deal with those little baby scan photos coming through. So they don't do social media. I mean, that's probably not, they're probably winning in that respect.
Yeah,
because now we know how bad all that stuff is.
yeah.
But
However,
it's a sense of isolation
yeah,
and keeping yourself apart and this loss of connection. And then the cost, the relationship costs. We've got episodes that dive into all of this, and you've experienced some of that yourself as well, JJ.
yeah.
The impact that this has on women is significant. And if only we could recognize it, recognize what we were seeing, and then offer them an opportunity to say, this is what you're dealing with. And if you want to get over this, this is what you need. Go and see these people over here. And then
Because it's
the women
always a
have the
choice.
choice.
Yeah, it's always a choice. But I can't, looking back on my life, if I'd been given that choice a long time ago, oh, I would have taken it, I would have grabbed it with both hands and gone down the healing route. Yeah. My
Yeah,
life would be it would have been so much different. It's so different. There's so many things that I can see now would have turned out completely differently. So
yeah,
many choices I made, so many things that I did. And I'm not saying that I just went through life as a scaredy cat. That's not it either. But when you're constantly, living through this deep-seated anxiety, it does have consequences on relationships, your energy levels, your ability to create anything, bring anything to term
yeah,
into this world. It's huge.
yeah.
And so and that is why I am here, because I don't want anybody to wait until they're in their late 60s before they find out about this. And I'm starting to cry now, and I'm going to have to stop speaking because
No, I know, but
this isn't this isn't the hay fever anymore.
No, I've got hay fever as well. But even as you're speaking, I'm like, and I know I figured it out earlier in life than you did, but it was still really late for me. And so,
Yeah,
I had my first baby at 36 and my second at 40. And they're like teenagers now. And I wish I could have had kids sooner. Like I just, you know, yeah, what I missed out on as well. And it just really, I just hope that we can at least bring about some change with doing this because it really is unnecessary.
it is
And it's
unnecessary.
unnecessary
Yeah,
because like well we've been giving birth for like millennia, like how has this not been spotted? It's
yeah, I
not
know.
like we're responding to how we react to solar panels that's just only been around for a few decades.
I
We've
know.
been birthing for God knows how long,
As
and
long as as long as there's been
exactly,
mankind, basically. Yeah,
I know. And so how do we not know about this? How has it managed to fly beneath the radar for so long?
I don't know. I do not know. But the good thing is that we're doing something about it now.
Yeah. And I think just to go back into some people might be saying, well, okay, you're proposing RAD. So
Yeah.
what's tocophobia then? Is that still a thing? Are you saying that this is a new name for tocophobia? Like, what's tocophobia? And that's a fair question. And I want to kind of deal with that one. And so for me, like, you can have tocophobia without having RAD. And so let me just explain that. And I see this very clearly in clients. And in fact, without realizing it, I've got two key programs I have when I work with people. And now when I look at them, I go, oh, yeah, that's the RAD program and that's the tocophobia program. And in fact, yeah. So the tocophobia is like she's generally in a really good place. She would say she's probably confident and, happy. And then suddenly out of nowhere, she's aware that she's got this fear of childbirth and pregnancy, and there's a thing going on there. But other than that, she doesn't have anxiety. She's in a good place. And then you've got reproductive anxiety disorder, which has got tocophobia and all the
And
siblings,
everything else. Yeah,
right?
yeah.
And so dealing with tocophobia within that landscape is a very different thing. And I
Mhm.
approach that differently because we've got to deal with other things to kind of bring out, there's a lot more going on there.
Mhm.
And so tocophobia is almost like a subset of reproductive anxiety disorder because reproductive anxiety disorder, again, we don't know because we have questions, but it maybe impacts menstrual cycles and how women experience that, the menopause,
Yeah,
puberty, how they went through that. The repercussions of that are significant. And depending on the kind of trauma that was a root for them, again, trauma is just such a complex thing in itself, and whether the trauma, are we talking about CPTSD? So there's a client I'm working with at the moment. So she had tocophobia, then she found out she was pregnant. So then she had the moment, the CAS, the moment that we've talked about.
Yeah.
Um, and then she could not handle staying pregnant. She was like, it was me or the baby.
Yeah.
And so she chose to have a termination
And
without
this
telling
is,
her
yeah.
husband that that was what she did. And so she told him it was a miscarriage. And then for years, she's carrying all of that. Um, so she's now got a lot of traumas stacking up. There are some that are unconscious,
Yeah.
some that are conscious. And then if you throw into that the mother wounding, because obviously this is all about women becoming mothers, whether or not they ever become a mother. And it brings into all of that your own relationship with your mother and whatever that was. Now, obviously, some women have got great relationships with their mother, others don't. Others don't really have their mother around or whatever's been going on there. I mean, that's a whole,
We'll talk about that another time.
yeah,
Yeah.
that's another big, but
Yeah.
that also plays into this, right?
Hmm.
Because as you start confronting the idea of you becoming a mother, you start thinking whether I want to become, will I turn into her? You know, all of that comes into play. So
Mm.
whatever your childhood was like, your childhood traumas, unresolved childhood stuff, is all going to come out too. So, and again, I see this with the clients I'm working with, like where we get to the bottom of the fears that are specifically tied into or connected to the birth and the pregnancy. And once we get through that, they realize that actually, oh, there's abandonment issues going on. They're worried about
Yeah.
being alone. There's suddenly all this
Yeah.
childhood stuff rearing its head, and then the mother wound starts rearing its head. And so all of that stuff I would put quite happily over in the rad category.
I,
Whereas, you know, if you haven't got all that childhood stuff and the mother wounding stuff and you know all that, you know, you could just have this phobia that's rooted in a trauma and you heal that trauma and then you're done, right? So yeah, so for me, tocophobia still is a thing, but I just don't think it encapsulates the fullness of that experience for some women, for many
no,
women.
no, no. And now we really do need to have the conversations to talk about and help people understand that there is a far deeper thing, far deeper anxiety, a far greater range of issues within reproductive anxiety disorder,
Yeah.
and help people get over it, help women get over it, because it's it's unconscionable that we allow ourselves to go through life with these shackles on us, which is what it is. It's like we're shackled, we're confined by this fear, by this anxiety,
Mm,
and we don't need to be.
no. And really this why it's so important is because this isn't just a personal issue, and it is, but it's also about the system that we're
Yeah.
in, the healing system, the medical system, whatever, you know, the system that we're in that might enable us to kind of come out of this. Because rad, I think, once we start peeling that back, we're going to really start getting a handle on or better understanding on fertility and what
Yes.
impacts fertility
Yeah.
and therefore birth rates. You know, we're currently facing an existential crisis with falling birth rates
We are.
everywhere. And and isn't it interesting how we've got this, you know, obviously there's so much data and so many things colliding, but when you think about the history of birth, you know, up until the 50s, most babies were born at home and it was the village and it was women supporting women in the birthing environment. And suddenly in the 50s, it all came into the hospital and it all became medicalized.
Yeah.
And so then from the 50s, you've now got a medical birth that could now start being the beginning of an increase in babies experiencing their birth as birth trauma. And now those women are now adults. And now you've got, and this is where you start seeing the rise in tocophobia, the rise in anxiety in women. Are those two things linked? Question mark. We don't
Interesting.
know.
Interesting, because I was born in a hospital. I
Same.
wouldn't be alive if I, well, so here's the interesting thing. I wouldn't be alive if I hadn't been born in a hospital, but would I have gone through all of that if I hadn't been born in a hospital?
Right. Yeah.
If I'd been at home, my mother relaxed, there are all sorts of things going on around the pregnancy. I came out 8 years after my sisters. So, I was, she thought she had a family. She didn't think she was going to have another baby. So she was a bit worried about it. If I'd been born at home, would she have been relaxed enough? Would I not have had the cord around my neck when I was born?
Yeah.
So you do have to ask the question, don't you? Because I was in a hospital, because it was all hospitalized, because it was all very kind of, scary and different.
Yeah.
Is that why I came out that way? I don't know.
We do
Fascinating
know
thing,
that
isn't it?
with home births, as long as there's no complications to the pregnancy, there's no reason why you shouldn't be able to birth at home. The hospital, like the big problem we've got here is we're looking at pregnancy like a medical condition when it
Yeah.
is not a medical condition. Normally you go to hospital when there's a medical condition, whereas pregnancy is not that,
No.
unless the mother has a medical condition related to the pregnancy. Maybe she's got diabetes, maybe she's got something going on, maybe the baby's breech and that they might need a specialist to deliver the baby that's got breech training. So there might be certain situations where it would be beneficial to be birthing in a hospital. But if there aren't, in the absence of all that, when there's a healthy baby and a healthy mum, birth at home, right? And that's the best place, right?
Yeah.
But that's changed significantly. And so, and now you look at what the C-section rates are doing. I mean,
Oh
they're
God.
just getting up to 20, 30, 40, 50% in some
Yeah.
countries.
Yeah.
And what that's doing to the nature of babies that are being born, because that's quite a significant shock for babies to experience. One minute they're there, next minute they're being yanked out in bright lights. So
Mm-hmm.
there's all of this could be having an impact. I say could. I think it's pretty damn sure. But let's do some research. Why not? Because
Yeah, we don't have the numbers, do we?
we
We don't
don't.
have the actual
No one's looking at
research.
it in this way.
Yeah, exactly. Exactly.
So when we look at it like this, the impact, yes, it's on women and their mental health, but birth rates, fertility, um, relationship longevity.
Oh yeah,
You think about
absolutely.
how many
Yeah.
relationships fizzle out or they have to end because there's an issue around this point. You yourself cite this as being
I
potentially
do.
behind.
Yeah, but behind one divorce, yeah.
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 So is this behind, is this a contributing? Do we need to know more about that, but also around public health policy? Like once we start understanding the impact of RAD, how can we change systemically to be able to deal with this and heal it? And when you think about the impact of a difficult birth, the ripple effect on that is significant because the birth moment has the mother, it has the baby, it has the partner. Now, if that experience is not a positive one, they're all affected. And
Yeah.
then if they're then struggling as a family unit, then they're going to be bringing in social care, mental health provision. Like the baby then now has a trauma that is going to hit them when they're an adult and the anxiety that they're going to deal with. So that birth moment is everything. And with all of
Yeah.
my work in fear-free childbirth and my book Fearless Birthing, it's all about protecting the sacredness of that moment and doing whatever you can as an expectant mother to do everything within your power to protect that moment and that baby's experience, because that's the generation of the future. That's what's going to get us out of this mess, right? That's the reason for all of the work that I do, is that one moment. And RAD helps us to do that, in my view.
Absolutely. No, I agree with you. That's why I'm here.
That's why
Yeah.
we're both here, right? And thank
Yeah.
you for being here, JJ.
Thank you for being here. So glad I met you.
So,
Oh,
so how do you know if you've got RAD? I mean, just to sort of think about as we try to wrap up on this, because there's so much
yeah.
more that we're going to be saying, obviously, with other episodes. And there's a white paper on this, which we haven't mentioned
Oh
yet, which I
yeah.
feel like I should
Yeah, no,
mention,
yeah. Yeah. You can
because
get
I
that
would
now.
like to get RAD on the DSM, which is the big Bible of mental health disorders, right?
Yeah.
And so I've written a white paper, the case for RAD. So you can get that from the fearlessbirthing.com website if you're interested in reading that. And obviously that provides a lot of the groundwork, a lot of the thinking that's been going into all of this and what we've talked about today. And to help to put out research, a call out for research. So we collaborate on research so we can find out more, get some of these questions answered that we're raising today.
You can also
Um,
find it on the Tik-Tokophobia.com website as well. So,
yeah,
good.
also, yes.
Yeah.
So how do you know if you've got it then? Well,
How long have we got?
where do we start? We'll keep it short, right? We'll keep it short.
I think so.
Yeah, I mean, avoidance, we've talked about some of this already, so I don't want to go on about it, but like the
No,
avoidance of all things babies, of sex, of intimacy, of
pretty
the idea of
much. Yeah.
family planning, holding a baby, all of that thing.
Those are all good signs. And
Yeah,
there are more subtle signs as well, but those are a good starter.
yeah. And the thought, like, I think the family planning piece is if you're facing, it could be that you, like for me, I knew I was going to be a mother. There was a part of me that knew I was going to be a mother. And that part of me had this imagined future that was really far apart, like far in the future. Like if I was on a landscape, there was between me and it, there was a massive gushing river that was just there was no way I was getting in there and no bridge. But there was a beautiful meadow on the other side. And over there was me with my two kids. But between me and there, I had no idea how that was going to work.
And
How
I
I was going to get across that river, no idea.
and
But
I
it was
didn't
this
even
lovely,
have that. I didn't even have
didn't
that.
you?
No, didn't even have that. It was just it's not going to happen to me. It's not happening. Not happening to me. Don't know why, but it's not happening to me.
But if you imagine like my story, so I'm over there and I know I've got to go that way, but I'm going that way. Like I'm not even going that way. And I know I'm trying to figure out a way to get across that
Yeah.
river. And there must be a bridge somewhere along this river, but I'm not interested because I'm going over here. So even though I had this kind of, maybe it was a yearning, whatever, I never did anything about it, even talk about it. So this is why I was in a relationship for 8 years and we'd never had the baby conversation, even though I was 36 at the time. I mean,
Yeah.
that's big clue right there. So this
It's
idea of even talking about it, that's a really big clue.
big clue.
I know. And I even say to my other half, and I was like, how did you did you try having this conversation with me? How did you just think, oh, nothing's going on there? I'll just this one, I'm gonna sit this one out. This is clearly not gonna be my life. If he's like, well, I'm not he's super vague on the matter. But yeah, for partners listening, if you try and have that conversation with her, like, what's going on? How is she responding to that? And if it's like a suitably in the distant moment, like, oh, we're getting married and we're in our late 20s, we want to have a family till like 33 or whatever the number is. And then 32 rolls around. What's going on with her now? Is she like thinking, oh my God, I said 33? Like, what's happening with her? Like, for the partners to be like, to pay attention.
Yeah, to be aware. Yeah. Pay
Because,
attention, be
yeah,
aware.
because that could be, because the sooner you start identifying it, the sooner you can sort it out.
Yeah. Yeah,
Because
don't be scared to have the conversation, and it's all good. We just need to bring it out into the open and understand that it is a thing, because for
yeah,
a lot of us, we just don't know that it's a thing.
yeah, yeah,
So we stumble around in the dark, and before we know where we are, we've missed the boat.
yeah, yeah. So, I mean, I think we've dived into a lot of that today, JJ. I feel like I want to wrap it up there. There's a
I
lot more
think
to
I think
say,
yeah, we'll be
obviously, but
talking more about stuff
we
anyway.
will. But I think it's really important to like fairly early on to share our perspective on RAD
Yeah,
and invite people to get the white paper, read the white paper, let us know your thoughts. But
definitely.
as far as I'm concerned, in the work that I'm doing, and I've been working with women for over a decade on this, for me, reproductive anxiety disorder is a real thing. It's not a flaw, it's not a weakness, it's just something that you're dealing with
Exactly.
that you can heal. It's findable, it's fixable, we can deal with it. And like with all my work around my head trash work, it's like we have all got head trash. It is nothing to be ashamed of. It's like the rubbish bins at home. Everybody's got bins outside their house, and that's because we buy stuff, get rid of stuff, and need to get rid of it. And we put it in the bin. Nobody comes around and shames you for your rubbish bin. The
No,
same goes for our head trash. We've all got it, and it just comes in different shapes and sizes. And we just, once we know about it, we get rid of it. Once you found that like weird rotten apple that you've left in the fruit bowl, you don't just leave it there. You get rid of it, right? That's all
yeah,
this is. We're just identifying head trash and getting rid. And
exactly. And so let's all get together and do that, and join us on another one. I think we'll stop it there. Do you
yeah,
think?
See you next time on Tik-Tokophobia. Bye.
Yeah. Bye.